Director of Government Affairs here at the ARC of Massachusetts, and we're here today to talk about the importance of Medicaid-funded supports. I know this is a topic that is really important to so many folks and really hot off the presses every day now. It feels like there is news on Medicaid and potential cuts. So we're going to spend some time today talking about the importance of these supports and then how we can all advocate together to protect them. We have a really wonderful panel here full of providers and parents and experts. But to start us off, we're going to go through a couple of quick slides to set some context, and then we'll do our panel, talk a little bit about advocacy, and then we'll have lots of time for questions at the end of the discussion. In the meantime, though, feel free to put questions in the chat, and we will try to take them all together at the end. And we will also share out a recording of this webinar and all of the slides later. So you'll get some materials emailed to you soon after today's conversation. But to kick us off, I'm really pleased to turn it over to our fearless CEO, Maura Sullivan, who's going to talk a little bit about Medicaid and kind of what's on the table before going into our panel.
Thanks, Nora. I don't know why I'm fearless today, but I'll take it. And I just want to say thank you to everyone for coming today. What we're seeing kind of across the state right now is just really turned up engagement on learning and just getting better educated around the topics that we need to talk about more, not just to our legislators, but to everyone we know. It's really important to get the message out that these services will affect our families if they are cut, and just what that means to us. So I know Nora's going to talk a little bit more about the critical advocacy piece, but education and feeling competent and empowered is a really big part of advocacy. So we just want to take you through some really high level kind of understanding of Medicaid and then turn it over to our experts. And I'm really grateful to them for being here today. So in case people don't know, Medicaid is Mass Health, and I will put in a plug for all of our fact sheets that are on that are available on our website if you want to have them for after this webinar to hold on to. But Mass Health and Medicaid here are state and federally funded programs providing healthcare coverage, which most people know, and long-term care to more than 1 in 5 people across the nation. And as many as 7.8 million receive home and community-based services funded by Medicaid. We also have the Medicaid waivers, which are critically important here in Massachusetts and provide 50% funding for much of our services for adults, and there's also waivers for kids as well. And then the areas that we're going to focus on today through our expert panels is areas of DAHAB, which is just so important to so many people here in Massachusetts, adults, adult family and foster care, PCA services, and we can touch on waivers and other things in the question and answer time as well. I'm gonna keep going. Yeah. Okay, so what's really at stake here? People may have heard that what came down from Washington was that we are looking at potentially $880 billion in cuts to Medicaid programs over the next 10 years. And, this is pretty much what's happening right now. We are in the moment of our congressional delegation and just the folks in Congress really figuring out how they are going to manage the kind of fiscal cuts without really impacting Medicaid and people who are in desperate need of these services. It's all on the table, so this is the right time to learn and to be out there advocating. And I think our voices are making a huge difference already. the way that we think things might come down if we are faced with these cuts could be a few different ways. You might have heard of the per capita cuts or block grants. They're looking at work requirements or cuts to just the federal matching rates for states. So all of those things to us are not good news. You know, if you think about the way it would come down per capita, CAPS is really looking at the individual and deciding, you know, that this person has a certain amount of money over a lifetime, and then they hit a cap and they're done. I think that's a terribly short-sighted way to look at long-term support services. The block grants would be more, you know, giving Massachusetts a certain amount of money and having them figure out the way they wanted to do it, but it would most likely be significant cuts. And then, you know, in terms of work requirements, as it relates to people with disabilities, we've tried this in other states and it doesn't work. It doesn't work to reduce cost, and it ends up causing more problems for people who really are unable to meet those requirements and maintain eligibility. So the cuts to the federal matching may be something that we do see this year. And that would really tighten up all of our programs. So again, none of these things are good news, especially given the current state of Mass Health Medicaid in Massachusetts, where we know day habs and other programs are really struggling to bring staff on and to really meet the needs of our community. So that's just a little overview. But let me let the experts really take you through some of these programs, and I'll do a really quick intro of these three individuals that have joined us today. I'm so happy to have Anne-Marie Bajwa here. She is the president and CEO of the Charles River Center, ARC, and I'm so happy to have you as one of our ARC CEOs. But Anne-Marie's worked in the nonprofit sector for 35 years, developing and implementing programs and services for adults with developmental disabilities. And she came to be president of the Charles River ARC in October of, 2016, after serving as COO since 2008. So she's played a pivotal role in the growth of the Charles River Center and has overseen day hab, residential family support, and employment. So thank you for being here, Anne-Marie.
Thank you for having me. Appreciate it.
Of course. All right, and I want to introduce you to Alexis Hill, who's the Director of Public Policy at ADDP. And we are so lucky that we have such a strong partnership, the ARC and ADDP. That's the Association for Developmental Disability Providers, if people don't know. And she's been there for about 3.5 years, graduated from Georgetown University Law Center. And she's really been honing in advocacy skills. And she's one of the leading authors of the Americans with Disability Act of 1990 and 2008 amendments, which is really cool. And her areas of focus at ADDP are adult foster care, adult long-term residential services, shared living, and LTSS community partners. So thank you, Alexis, for being here.
Thank you, Maura. I just want to clarify, I got to study with the person who wrote all those cool parts of the PA. I personally didn't. Don't want to take credit for that, but it's very important legislation.
Well, definitely. I'm glad you were involved in it. That's wonderful. Okay, so I want to move on to Jean Clapper, who is here with us today in two roles, and she's a parent of a wonderful 34-year-old daughter, and Stephanie. And she's also has extensive personal and professional experience with supporting individuals with IDD and autism and their families. She was the former director of family support at the nonprofit agency, and it was contracted with the Mass Department of Developmental Services. She's advocated for improved services and for culturally and socioeconomically diverse families who are impacted by IDD, ASD, and complex medical. So thank you so much for being here, Jean.
Thanks for having me.
Okay. I made you that. All right. So should we jump right into the questions for the panel? All right, great. Well, I think what I would love to do is have each panelist just give me a brief overview of the programs that you're kind of here to talk about today. And, I don't know if we want to start with Anne-Marie, and I think you're going to focus a little bit on DayHab.
Right. So thank you, Mara, and thank you, Nora. So the Day Habilitation Program, in case you don't know it, is funded through Medicaid, and I call it a medical therapeutic program because it is like a one-stop shopping, if you will, and it's a very efficient way to deliver community-based services. And that is, there's nursing for those that need nursing oversight or nursing treatments. There's a nurse on site during the day program. So it's a day program, right? So it's Monday through Friday, typically 8:30 to 2:30 or 8:33, 6 hours a day. And there's also access to occupational therapy, speech therapy, physical therapy, behavior management. So that's delivered on a consultative basis. So those therapists will evaluate each participant and come up with goals, objectives, treatment plans, and so forth to address any need areas they have in those disciplines. It is the main focus of a day habilitation is to learn new skills and to prevent regression. Okay. So I love the program because there's a lot of services delivered in the 6-hour day, and it's usually delivered in the form of fun activities, right? It's very community focused. So you might address your PT goals of balance and walking on uneven terrain while at the bowling alley, going up and down the stairs and dragging this heavy ball and throwing it. So there's ways and activities that can be done, things that can be done to address these needs. So it's a great service. I've been involved with the service for a while. I was a co-chair of the coalition. I just love the service. And it's very much needed for our population. There are a lot of people, some day habs serve more of the medically intensive or clinically intensive people. So they might have more nursing hours than, say, another day hab that focuses really on the autism population and the higher level skills. And there is still all of the services available that I mentioned, but just in varying degrees, sometimes based on the clientele at the programs. It's heavily regulated. There's a lot of things that Mass Health requires that the day habilitation programs do, and assessments and who signs what and so on and so forth. But it's a very valuable service. So
thank you so much, Anne-Marie. Yeah, that is a really great explanation of all that goes into the DayHab program. I think maybe I would jump to Jean and just ask her, because it's a program you utilize, and maybe from a family perspective, you could tell us a little more about it.
Sure. My daughter has participated in it now for about 12 years, which is hard to believe. She has some nursing needs, as do others. So it's critically important that she's in a program that can not only provide the daily nursing interventions that she needs, but then also clinical oversight and just to keep eyes on. And, we've certainly had occasions where we've gotten, and just to preface, my daughter is nonverbal. She has a unique chromosome translocation and microdeletion, the only one in the world. So she doesn't follow a, complete set of rules. But we've had calls from the nurses that say, she's just not herself. We think we need to transport her. And I mean, that's invaluable because there was clinical oversight, but not a clear picture of what was wrong. So that daily intervention for her, both on the medical needs that have to be addressed daily, they take care of that. And then as Anne-Marie mentioned, it's a Monday to Friday program. They embed OT, PT, speech, behavioral if needed. And then, they have an exercise room, but they also go out in the community. They have Zumba and, different games. They have outdoor gardens at the center that my daughter attends, so they can do gardening, and it's terraced so that individuals in wheelchairs can also access it. And it really just provides a sense of not only the clinical nursing intervention and oversight, but a community. If a community where my daughter has a much broader array of peers. She can't pick up the phone and call someone. She can't, I mean, she can FaceTime us, but she can't, engage in friendships independently on her own without this. And she has a great community there, both of the individuals that attend the day hab, which are ranging in age from, typically 22 up to, the higher end, older folks that are still attending. And that's great. There are people with all kinds of needs, some that are more involved than her, some that are less involved. And as my daughter being our firstborn, she always thinks she's the mother hen. And so she loves to help others, as most people. We all want to help. We're all helpers, in some way or shape or form. And that's what she is able to do on occasion there, push somebody in their wheelchair, if need be. And that brings her joy. So it's really, again, that's just the tip of the iceberg of what it provides. And again, I think Anne-Marie, you touched on most everything. So I can leave it at that.
Yeah, no, that just really helps illuminate what a day looks like for your daughter, and the importance of just being able to meet the needs for the social determinants of health every day, the structure, the social piece, and just that ability to provide the services that, we may have had access to under 22, but it's not always as easy to have that kind of service available as adults. And some folks will continue to need that. So being able to prevent that regression, as Anne-Marie said.
Ice cream in one of them, that's the most important thing.
Right. And, we saw some of that during COVID, right? We can talk more about what it looks like not to have these services later. But I wanted to see if Alexis could jump in and talk a little bit about the programs that you're here to talk about.
Great, thanks. I'm here to talk about adult foster care. A more appropriate name for it is adult family care, but the state uses foster care. So if I use that term, that's why, because I'm used to having to talk to the state. AFC is a collaboration between a community-based organization such as Charles River, or there are many others in the Commonwealth, the person receiving supports, and the person's caregiver. Now, this setup is going to change from family to family and organization to organization, but the program is a way to support people to remain living in their own homes rather than other residential settings. And to be eligible to receive AFC, one must be 16 or older, unable to live alone due to a physical, medical, or cognitive disability, be eligible for Mass Health, and require assistance with one or more ADLs.
What? They didn't have it.
Oh, I'm sorry, was that a question? I couldn't hear.
I don't think so. You can keep going.
Okay. I just want everyone to know, if you're not familiar with AFC, the unfortunate thing about AFC is that legal guardians and spouses are prohibited from serving as caregivers. Now, the ARC has done great work with proposed legislation to try and change that. ADDP is, obviously very supportive of those legislative efforts. It's been coming up year after year, but that's a critical piece of legislation to change that. But in general, the community-based organizations, they visit the family monthly, they develop a care plan, they oversee a medical plan. The caregiver is given a per diem stipend or a monthly stipend. The minimum of those stipends is either $25 or $49 per diem. It can be more than that. That's just the minimum it could be. And that's depending on the level of support needed. The state breaks AFC into sort of two levels, and depending on how many supports you need with ADLs. And the provider organization supports that are provided to a family are going to change from organization to organization. So one organization may always have an RN come out. One organization may not. So it's important, if you're looking at AFC, to sort of ask about the program of different organizations, because it's going to look different from organization to organization.
That's great. Thanks, Alexis. I was going to ask, in case people were wondering, sort of the difference between PCA to AFC, or what makes people choose one program over another.
So there's sort of a numbers crunching, right? That sometimes gets done, and that's really sort of the way someone decides to go with perhaps PCA over AFC, or depending on sort of the living situation. It's important to work with a community-based organization to sort of look at it holistically, to tell folks if they're eligible for one or both, and if both, how to choose one or the other. And there's managers and directors at these organizations who specialize in that. So I think that helps people figure out, of all the services out there, what's the best one for their family.
That's great. I came up in the chat about the bill, and I just wanted to mention that this continues to be a top priority bill for the ARC, to allow family caregivers who are guardians to be AFC and PCA providers. We really struggled last year not getting it out of healthcare finance, and even though it was hugely supported by many organizations and so many community members. So again, it's slated as one of our top priorities for this year. I think the issue we face, and then we'll get into that right now, is the increasing spending in mass health, right, is something that we're really aware of as a concern right now, given the potential Medicaid cuts coming down and the struggles we've had in recent years to get increased funding for day-hab and for PCA. So when you think about bringing on parent caregivers or guardians as PCAs or AFC providers, you don't really think that it would be an increased cost, but the state has looked at that and they believe it would be an increased cost. So we have to think about the whole effect of that program, and how caregivers who are single moms could possibly get an income this way and maybe not have to be on state support services. There's a whole lot of cost benefit that we really need to be pushing as our top advocacy pushes this year, to help balance that argument a little bit. But again, if you're interested in testifying, I see some things coming through. Definitely get in touch with Nora. We're building our coalitions right now for those bills. But I will say the hearings are popping up quicker this year than we expected. We had our first priority hearing just yesterday, and they'll be coming quickly. So if you're interested in testifying on that, get your testimony ready and reach out to Nora.
And Maura, I just wanted to add on the PCA and AFC, in addition, some families might have, when you do the number crunching, they might have a higher, it looks good on paper. Oh, PCA is going to be the better route for me. If you have somebody to do those and provide those hours, and that's critical. Often families would say, oh yeah, well, I get 35 hours, 40 hours, so that's what I'm going to do. And I'd say, but is somebody filling those? And they'd say no. So you have to balance what it is, and for those that haven't gone through age of majority, that is another thing to consider, because you cannot be an AFC caregiver if you are the legal guardian. So there's a lot. And again, as you had mentioned, Alexis, reach out to agencies, interview many agencies, and talk to them about, what are the pros and cons of each for your family. And if you are able to fill those with, community member or family member PCAs, then it's great. But if not, the numbers don't always tell the full story.
Yeah, that's a really great point. Before we leave AFC topic for now, Alexis, could you just talk a little bit about what cuts might look like if they did come down to affect AFC programs?
Sure. We don't know the specifics of exactly what would happen to AFC. We know that more than 15,000 people receive AFC services in the Commonwealth. But the important point that I want to make is that any cut to Medicaid will affect all services. And that's even beyond just mass health services, it's DDS services. EOHHS said at one point they would expect to lose $16 billion. We know that the Department of Developmental Services, so that oversees different programs other than DAHAB and AFC, things like long-term residential, but even DDS, they rely on half of their funding to come from the feds. And we know that rural hospitals and community health centers, which provide care plans and care management and maintenance and support for long-term health conditions, without which people would end up going to the emergency rooms, those would close. So they're all inextricably linked. And I have no doubt that AFC would be cut. It's just the amount we don't know.
Okay, thank you so much. Nora, I don't know if you want to jump in with the next set of questions.
Yeah, I'm going to jump in here and kind of turn the tables and pose a question to Maura as well as Jean. Talking from a family perspective, can you talk a little bit about if these programs were to be cut? And as Alexis just mentioned, there is a lot of uncertainty here, but trying to prepare ourselves for what might happen. Can you talk about how that would affect your family? What would it mean? What would the impacts be on your loved ones?
Yeah, I can start. I've been really lucky to have PCA services for both my sons since a pretty young age. I've also been really lucky to have consistent staff, which I know is really a struggle. And honestly, I don't know how I would be able to keep up with all of their daily needs without some PCA service. As they've gotten older, our PCA hours have slid back a bit, so we have less and less, but it makes sense because they've learned some skills. But other things really, they continuously need support on. So I hold on to those hours, with all that I can in terms of, I know without them, we will see slipping back. It helps me as a mom. I really need a break from a lot of the, support around ADLs, activities of daily living, all the hygiene issues, the teeth brushing. Sometimes it's just great to have someone else doing that, and giving me that break. And also, obviously, so that I can work and provide for my family. So I've been really lucky. I have the DESE DDS program for my youngest, and that gives me a couple of hours, not very much, but a couple hours a week where I can bring a BCPA in who does some kind of little bit of a plan for every week. And then the PCA can really help me implement that throughout the week for my sons. So yeah, I would be so lost without those hours, and I do everything I can to keep my PCAs engaged and happy, and really make sure they know how much I appreciate their work.
And I would just add, I mean, that's great, Maura. And I think the PCA program, again, that helps, when I used it with my daughter, when she was living at home, it would not only help with the ADLs, when I could find a PCA that could come and help with the ADLs, that was great. But there were also opportunities for them to take her out in the community and work on additional skills and socialization, maybe go to the bank, learn how to, potentially order something at a restaurant or all sorts of things. And again, it's been it was a huge benefit both to her, my daughter, and to the community at large, to have her integrated into that community. When I'm at home either working or with other children, as most parents are, you can't always take that one-to-one time to do those those important things that are both important for the individual receiving the PCA services, but also at the greater, the community at large. And then many of those connections that they make, and I'm sure you've had the same experience, Maura, those individuals end up going into fields of, special education or, whatnot. And it's because they started as PCAs perhaps at an early age and have carried that. So I think it would be, the PCA is crucial for families, especially families who have their kids living at home and are, have significant needs, everything from bathing, hygiene, toileting. As they get older, you can ask for laundry support. If you're doing their laundry, because of, soiling and whatnot multiple times a day, and they're not able to do it, those are things you can ask for as they get older if they don't acquire those skills. So very critical
Yeah,
program.
and I would just say also just having that, even when I'm there, just having that second set of hands and eyes. And when you mentioned being out in the community, I mean, safety is still a really huge piece for my sons. And, as we get out into the community and, in parking lots and street crossing and, just any transition in general, it's exhausting to always be on and having that person able to be there and supporting. I mean, the thing about PCA here in Massachusetts is it continues to grow for a good reason. This is how we are keeping people out of institutions. It's how people are having meaningful lives, being safe in their homes, even being able to get to jobs and having support for working. So I think the program has grown from 1.2 billion in FY21 to 1.6 billion in FY24. So we continue to grow, and that is truly 100% need-based growth.
Thank you both. And just a reminder for folks to keep putting questions in the chat. I'm trying to answer what I can in writing, and then we'll go to ones for the panelists at the end. But I do see one on this topic. Can you talk a little bit about finding PCAs? Are there good resources out there for folks to know? And then again, we'll come back to the other questions at the end.
Yeah, I'll mention, I saw that one. For me personally, I've been able to find PCAs through my son's schools, but also through schools that are in my town, in my area, because then it's a little more convenient for the person, who's coming after school or whatever. But also just, I had a PCA for a really long time who was, a family friend. And then I was able to use my daughter as a PCA for a long time. So although parents can't be PCAs of their guardians or AFC providers, there is the family member piece, which can be really helpful too.
And I think there's still the PCA directory, the Mass PCA directory that you can access through, I think it is masspcadirectory.org. So good. That's a place that you could look to find. You still have to vet those candidates as a parent. That's something you want to be sure of. And I think ideally it's best if you first start with your own network, as Mara had mentioned, schools, individuals who've known them, individuals in the neighborhood, put the word out in your community. And there's, again, there are lots of people that I still run into. My daughter's 34, I still run into, and they know her from school because she was in multiple grades. She was in, different locations, and lots of folks know her and reached out and wanted to help because that was a field that they were interested in. So I think that's ideal, but then you can certainly ask other people, look at the PCA directory. Some people put out ads for it. Again, care.com is another one I know folks have used in the past. So there are places. It's not easy always, and that's why then you can balance whether AFC or PCA might work for you, if you have that option.
Great, and I'll turn it back over to Maura to ask the last couple of questions to the panel, and then we'll go through Q&A in the chat.
Okay, great. Yeah, I think the last couple of questions are really about what the federal cuts would mean. So maybe, I don't know, Anne-Marie, if you want to talk about the workforce shortage and that kind of intersection and what the cuts could do to your program.
Sure. So one thing I want to say about Habilitation is that it is a Medicaid-funded program, and which means that it's an entitlement service. So what that means is if you're considered eligible for Habilitation services, you have the right to access this service. So I think when you're talking about Medicaid cuts, it's still, even though it's an entitlement service, meaning if you qualify, you could get the service, cuts would have a significant harm to this program. And when I try to think about it, because we're right now trying to budget for next year, we know the cuts are coming, how are we going to manage this? I think that one way they could cut, if you will, into the day hab services by reducing our reimbursement rate. So right now we get reimbursement for every for a day of service to each person. And if that rate, that day rate gets reduced, that's going to mean reduced staffing ratios. That's going to mean possibly layoffs or hiring freeze. And that means the wait lists are going to get bigger and bigger and bigger. If we don't have enough staff, you can't bring in people who need staff support if the staff isn't present. That's not safe. It's not good for anybody. I also think that the therapies and nursing hours are going to have to get cut. And so this really speaks to the quality of services, how far reaching are the services going to be? Jean spoke about in her daughter's day hab, they do things like yoga classes and bowling or whatever to make it fun. Those are not reimbursed through the day hab rate currently. So those are enhancement services to make it fun. We're adults. We don't like to do exercises. But if you take me to a bowling alley, I'll get exercise. So those sort of things, community trips are going to be reduced. The fun, the ancillary, the enhancement services are going to be reduced, and that's a problem. And when you talk about, we won't be able to give our staff, the current staff, wages, and that create, wage increases, and that creates an unstable workforce yet again. We're going to lose experienced staff. We're going to have disruption in the continuity of care. Folks, Jean spoke about her daughter, but there's plenty of folks who don't communicate in a conventional way. So you have to learn through experience how some of these people communicate pain, joy, boredom, all of these things. And if you have staff who just come and go as a placeholder to their working career, they're not going to develop those relationships and those necessary skills. I think this is all a serious, serious risk to the day hab, and it's going to exacerbate the already workforce crisis that we already have. We were just coming out of it, if you will. Many of us were able to hire more staff now. The day hab rates went up last year significantly because they hadn't gone up in, 10, 15 years. I can envision if there's Medicaid cuts, they're going to retract that daily rate again, and we're going to be right back where we were before. And that's a problem when it comes to day habs and these very, folks who have high medical, high clinical need. It's a problem. So I hope that doesn't come to pass, but this is what we're preparing for.
Yeah, thanks, Anne Marie. I mean, I think from the ARC's perspective, we are, so super concerned about the fact that there are so many people still waiting now. And that honestly, the equity issue here is at play, where those that have more complex needs are the ones that are having a hard time accessing services because they need that one-to-one support. And so thinking if there are continued cuts, will that impact those with the most significant needs even more? Is really our greatest concern.
Yes.
Yeah. So did anyone else have something to add there for day hab? Or
I was just going to say, again, mirroring a lot of what both of you have said, you're certainly going to see, if those are cut, it's going to be absolutely a decline in physical and mental health, similar to what was seen during the beginning of the pandemic, and when individuals were isolated. And I can speak to that. My daughter was hospitalized 6 times in a year during the pandemic, in the ICU twice, because of and it's because of a lack of that, and again, it was a lot of reasons, but it happened in a 1-year period after 11 years of that not happening. And, it was clearly because there wasn't enough oversight. It wasn't anybody's intention. She's nonverbal. She doesn't present in a typical way. And again, think of the pandemic, how we were struggling to keep staff, and she lives in a group home, a medical group home, but she was clearly isolated, clearly at risk. And we're going to go back to that if these cuts go through to the day habs, not only the isolation from their community and their, friends and the community at large that they get to to see and go out in the community and have all those fun things like the Zumba or, yoga or whatnot. But they're going to have physical, very serious physical complications if these are to go through. And for those that still haven't been able to access, to your point, Maura, I mean, that's a reason we need to increase these services and supports and increase the pay rate for the provider, the direct support professionals, so that they can care for the most involved. But we're not there yet. So it would be a drastic effect, I think, on this community if Medicaid is cut what they're talking about, especially in, for day habs and I think somebody mentioned group homes. There's going to be lots of places it's going to affect PCAs. So
yeah, that's so well said, Jean. And I do think we have so many lessons learned from COVID-19. And, I think, again, the cost argument comes in here. If people are hospitalized 6 times in 1 year, I mean, that cost alone is affecting the state more. And so, I think there's a piece here that we have to remember. The prevention is huge, and that isolation and the increase in mental health and the impact on the caregiver, not just economically, but mentally as well. So I appreciate those comments.
Piggyback on one thing about the workforce, just to not to state the obvious, but direct support professionals need to be paid more. A lot of them do rely on Medicaid. So the Medicaid rate is no lower in Massachusetts than the national rate. It's still 1 in 5 here. 40% of births fall under Medicaid. So the direct support professionals, in order to be able to stay in the profession, need supports from Medicaid for their own families. So if that gets clawed back, that'll have a knock-on effect.
That's such a good point, Alexis, because eligibility could get tighter and that could affect the direct support workforce. So wow, those are all such great points. Just, we really need to understand that these are all, uncertain cuts at this moment. And yes, we are hearing just yesterday, from the Speaker of the House that, oh no, we're not going to cut the most needy. But I think when people have looked at, how possibly this amount of money could come down without affecting Medicaid, it's hard to understand. Again, just getting back to advocacy, any of the panel members that want to answer, just, how important is advocacy at this moment?
Well, can I jump in? I just wanted to say it's working. The ARC has been a leader. At 1 o'clock, I think I can't watch it at the same time, but I've been watching the 24-hour vigil on the mall. That has been 24 hours of thousands and thousands and thousands of stories shared. And we were supposed to have a markup for this part of the bill last week, and it's been pushed off to next week. And that is directly a result of advocacy from the ARC, from lots of other national organizations, local organizations, individuals contacting their legislators. So it is working. And I just wanted to share an expression that someone said this morning at the vigil, which was, we all need to be co-conspirators in justice. And if we work together, we really can push this back.
Oh, I love that.
Well said. Well
The
said,
thing I
Alexis.
would like to add is that we assume that people at the federal government or even state government understand our population and the needs of our population. They do not. They do not. Unless you have a person who's availing these services, you actually don't understand the critical nature of these services. And so that's where the stories come into play. We can talk statistics. We can talk about a summary of what the program offers. It means nothing. But when Jean, your story about your daughter, it resonates. Even if you don't have a person with disability in your family, oh, that's what they do. Oh, I see. I see. So it's so important to get these personal stories out there so that they can latch onto them and communicate them. So our delegation can communicate them and speak intelligently and have that heartwarming, discussion with somebody where it really makes sense finally. So that's where our advocacy has through these vigils. And when we were meeting with some of the legislators earlier, it wasn't until we got to the personal stories. Let me tell you about this person I know, Robert. Here's Robert's life. Here's what Robert needs. Here's what Robert gets out of day hab or group home or PCA. That's the most important aspect of advocacy.
Absolutely. And I think inviting, those of you who have your, loved ones, children, siblings, whatnot, living at home, you can invite those legislators to come into your home. And, I'd done that in the past. And even currently, the state rep came to my daughter's group home. And that's what speaks volumes, is then when they see it. And I had an interesting this weekend. One of the individuals, my daughter is nonverbal, as I said. She can, does some verbal approximation, some sign language, some AAC, but all very, very limited, childlike. But what she does is she tells her staff, I love you. Thank you for your help. And I mean, it brings tears to my eyes because the staff said that is the best part of my day. And she'll do it repeatedly. She's very loving and she knows she's being well cared for. So my daughter mirrors that back to them. And, the staff has said her hugs and her I love yous make my day. And others that don't take the time to know individuals, and there's I've met many individuals over the years, personally and professionally, that may be nonverbal or don't express themselves in a neurotypical way, but they are certainly to be valued and to be loved and, and supported in what they need because they bring value to our community at large. And I think that's the message. My daughter will know when somebody is hurting and she'll, again, nonverbal, she'll reach over and rub their back. She'll hear them upset about something and she'll rub their back. I value that much more than many of the other things we talk about they talk about in government. And I think, that humanity is bringing that to the legislators and letting them see who your loved one is and what this would mean to you and your family would be invaluable. And they welcome it. You're their constituent. So.
They do. I agree with all of you. And yes, on a state level and on a federal level, keep the stories coming. I was talking to one legislator the other day and I said, my son seems really independent, but he sometimes forgets to actually chew his food. So for someone to stand there and be with him and say, wait, slow down. We got to chew. Remember to chew before you swallow. That's life-saving, right? So, and I've been there where choking is no fun. So some of these things are life-saving to our families, but people would not know that, to Anne Marie's point. But I think this is a great transition time over for Nora to talk a little bit about how we can jump into advocacy right now and just the critical importance. So thank you so much to all the panel members, but feel free to keep jumping in.
Yes, absolutely. I'm going to go back to the slides for a minute and talk about kind of what to do now. And then we will go to as many questions as we can fit in. And just to kind of transition us nicely, this storytelling is really what we're talking about. The picture on your screen is from a recent trip that the ARC led to DC to meet with our congressional delegation. And this is a photo of one of our advocates, Isaiah, talking to Congresswoman Presley. In addition to just making her laugh and I think brightening her day, he told his own story about Medicaid, why it was so important and why he needed her to fight to protect it. And that doesn't have to necessarily happen in person, although I love Jean's suggestion of inviting folks to your home or meeting them in the community, but reaching out in whatever way is convenient for you to your federal and your state representatives. We have the link here, which again, you'll get these slides to find your congressional representatives and get their contact information to share the really impactful story of how any of these cuts would impact you. We're very lucky in Massachusetts to have congressional leaders in our delegation who are all incredibly supportive of Medicaid, and we are not worried about them changing their mind tomorrow and voting to cut Medicaid. But they need our stories and have asked for these stories to help them be effective advocates in Congress and reach across the aisle to share. So in addition to reaching out to your own representatives, which is really important, even though they're supportive, We also encourage you to reach out to your networks in other states, particularly if your family or friends live in states where their representative is on the House Energy and Commerce Committee, which again, you'll get the link to. I know that's quite the mouthful. Thinking about if there's a representative from Idaho on that committee and your aunt or your cousin or your friend lives in Idaho, have them share your story or do that advocacy to their representative too. Reaching out and kind of thinking outside the box about how to have those engagements right now, I think is really critical. And I saw a question in the chat about timeline of when these cuts might happen. As I think Maura said at the beginning, it's an incredibly fluid situation. And Alexis mentioned that there was supposed to be a proposal written out this week, and that's been pushed because of this advocacy. So it's not quite clear exactly when we're talking, although Memorial Day and July 4th as deadlines have been floated, but really keeping up the pressure right now because it is working and we can't kind of let our foot off the gas in this moment. And then just to support you in this work, on our website, which this first link is to, we have a fact sheet about understanding Medicaid and what is on the table. So feel free to download that and read it and share it to really help people feel empowered with the information. And then we encourage you, if you aren't already, to sign up for our action alerts, the ARC of Massachusetts and the ARC of the United States. ARC of the US is our federal partner, and they're currently doing this action alert on your screen to reach out to your Congress people. And you can see, as of yesterday when I took this screenshot, 46,000 people have written. That's impactful, but we need that number to keep growing. So then we'll turn it over for questions. I'm gonna stop sharing if I can.
Nora, I just wanted to jump in on that last point around sharing with our congressional delegation, who already is behind these, supportive of Medicaid. But when we were in DC, it was a chance to give them the real specifics that they need and to make connections. And I think you're going to put something in the chat if people haven't seen. One of the women that joined us in DC this year had written a poem about Medicaid. And she, during our visit, she said, I'm going to share this with Congressman Auchincloss. And when he loved the poem, he reached out to see if it would be okay to share it. And then he read it on the House floor yesterday. And it was so powerful and so impactful. And it felt like, here we were, Massachusetts was right there on the House floor making our point. So way beyond our congressional delegation. So you never know, you could get, invited to DC to tell your story, or your story could be highlighted by connecting. Yeah, we'll share that. We'll share that amazing, amazing poem.
Yeah, and
if you
definitely
follow the ARC of, sorry, go ahead.
No, I was just gonna say, reach out to us here at the ARC. We're happy to kind of hold your hand through this journey, answer questions, help you write your story. And I think I put this in the chat, but we're doing advocacy trainings too to larger groups. So if your day program or your family network is interested in kind of diving in a little bit more, my email is in the chat. So please do reach out, and we're happy to help however we can.
Yeah, that was a really powerful poem. It was shared by, I think, the ARC of Mass and the ARC of the US, I believe. So if you follow them or on Facebook, or if you don't, and then, you'll see those things. And again, so impactful. It just spoke volumes to what we're trying to get the greater community to understand, and the legislators and Congress people.
Yeah. We only have about 5 minutes left, so I want to try to squeeze in a couple of questions here. And one, I'm just going to read it out from the chat, but open to anyone who's interested in answering. It's about CBDS funding. This is from Pam. She says that she knows funding for CBDS programs is through DDS, and the federal government provides about 50%. Where does the rest of that funding come from? Is that Medicaid? Can you talk a little bit more in detail about how some of these programs are funded?
Sure. I don't know, Anne-Marie, do you want to jump in on the DDS line items, or what we're really trying to fund through the state budget? And then they have that 50% Medicaid funding, but I don't know if you could talk a little more like specifically how that funding comes to CBDS or.
So how that funding comes, so it's we providers contract with the state to provide units of service for CBDS programming. It is I forget now if it's a 15-minute interval store, same, but which is crazy. So for every 15 minutes that we provide a day service to somebody receiving CBDS, which you know, we receive a 15-minute reimbursement rate, which is nuts that it's that small. It's a billing nightmare.
Yeah.
But again, you know, those units go up and down. And if the match is affected, I'm guessing they're going to limit the number of units and you have to spread it out among the people on your roster, which would be insane because frankly, there's a day custody issue. So where do those people go? Do they go back to the group homes? That's going to cost more money to staff the group homes. Do they go back to the families? Now they can't work a full day or a full week. There's a lot of impact to the economy there. So, you know, that to me would be devastating. That's a safety net for families. That again, it's Monday through Friday, 6 days a week. And you know, those programs let out at 3 o'clock, the person might get home at 4:30. That's not even a full work day for a lot of people. So it's a huge, and during the pandemic, there was reduction in services and the families couldn't work. You know, some of them had to leave their jobs completely. Some were able to work from home. That was good, but that's not always possible. And I don't see, you know, I don't see a cost benefit there at all when you talk about let's do dollars and cents here, forget it, you know, the human impact. And then how are we going to get staff if we don't have a full 6 hours a day to offer people? You know, we're going to lose staff because they need a full-time job. So it's just a trickle down effect that really is scary to me. So, but that match is huge. We count on that match from the federal government to appropriate money for services. And again, day services are struggling to get back to capacity prior to COVID. It's just the reality. There's a lot of people on a wait list. And right now, to bring people back, we've had to do part-time schedules. Again, huge impact on the family and the person served. So devastating.
And just to jump in on where the state comes in here is the state has to fund Chapter 257, the workforce, in order for us to have enough staff in those day programs. But they also have to fund the DDS line item that is for community day and work. So you'll see both of those as top priorities for the ARC in terms of our advocacy. We have amendments going on now for the workforce. We have amendments going on for day programs because we can't afford to let them slip. So stay tuned. The Senate amendments will be out next week, Nora.
Mhm.
Okay.
Yeah, definitely lots of moving pieces, both at the federal and state level. I want to sneak in one more question that I think is quick in this last minute. Alexis, can you talk a little bit about, someone asked for AFC, do you have to live in Massachusetts to be considered? Can you answer that?
Yes, you do. And you have to live in the caregiver needs to live with the person getting the services and supports.
Great. That was a great, quick last question. I know we didn't get to all of the questions in the chat, but again, my email is in the chat. So if you want to follow up on anything, and I'll throw it again quickly now, please do reach out. And again, another thank you to our amazing panel and Maura for your help in moderating. We know there is so much going on with Medicaid at the moment and really want to be a resource for everyone. So please do reach out, go to our website, follow us on social media, sign up for the action alert, sign up for our newsletter to really stay informed and up to date.
Thank you, everybody. These things really lift us up as staff for the ARC too. So thank you for being here. Thank you to the panelists.
Thank you.
Bye.
Everyone.